As you know, February is National Heart Month in America, and joining us this morning to talk about heart issues, in particular heart failure, is Dr. Tom Coffin. He's an interventional cardiologist with Princeton Baptist Medical Center. Good morning.
Good morning.
He's got his scrubs on. He's ready to go take care of some patients. So when we talk about heart failure, and I remember going to the doctors with my mother and father and hearing that term, and it freaks you out because you assume if someone says you're in heart failure or have heart failure, you're dying, but that's not the case. Is that correct?
No, not really. I mean, to be honest with you, most of the forms of heart failure are chronic, meaning they're a slow process that takes years and years to develop. And sometimes it can be really subtle in terms of the way people feel with it.
So you live with it, is what it sounds like.
Absolutely.
Right?
In fact, that's one of the neat things with our practice is we have a lot of long-term relationships with patients because we help them through this process, and we'll talk about that in a little bit about how we treat them. But
all right, let's go down the list of some of the things that you did send us here to talk about when talking about heart failure. Leaking of fluid into the lungs.
Yeah.
Is that what causes shortness of breath?
Right.
Or one of the things?
Exactly. Yes. So that's one of the first symptoms people will come in with, saying, "Hey doc, I'm just really short of breath."
Is that without exercise or with exercise?
Sometimes it can be initially with exercise. Sometimes it can be at rest. It depends what the degree is, but usually it starts exertion and then eventually can occur at rest.
So if someone comes and says that, what's the first thing that's done?
Other than listening to the patient and of course talking to them, things like an ultrasound or an echo is really useful to kind of look at the overall muscle strength of the heart and looking at the valves to see if there's any leakiness of the valves and things like that.
So one of the things, or several of the things that you look at, hypertension, high blood pressure.
Sure.
That is a major cause of heart problems, right?
It's the number one cause because it's a slow process, just like heart failure can be, and over time that causes the heart to thicken, and then it becomes poorly functioning, either by the way it relaxes or the way it contracts.
So it's almost like it hardens, right? So it can't pump as freely?
Exactly. Exactly right. So
now, do you feel any of those symptoms when that's happening?
So again, just like you alluded to earlier, it's mainly the shortness of breath people feel. They sometimes just kind of have a lack of energy, things like swelling in their legs. Those are kind of subtle symptoms that people will develop.
So how do you treat heart failure?
So the first thing you want to do is find out what the cause is, because that makes it easier to kind of use your treatment to get to the bottom of it. But if it's high blood pressure, for example, which is what we talked about, you're kind of working more towards getting blood pressure better controlled, and also getting on medicines that will help the fluid that may build up in the lungs to let people breathe easier. If it's something like coronary artery disease, which is another common cause of heart failure, you want to look at ways to look at the arteries in the heart, either by something like a stress test or even a heart cath or an arteriogram. And
that really gives you the image of what's going on, doesn't it?
It does. It does.
All right, and as we wrap up, I know I think we always think of a blockage. There doesn't have a blockage there for someone to have a heart attack.
Not at all, no. Sometimes people can have really pretty normal arteries, but the problem is when the heart relaxes, when the blood fills in the heart, that's where the real issue lies. And so that can be caused by multiple things, one of which is, like we mentioned, high blood pressure. So
if you have any questions, if you have any kind of symptoms, even if you think they're not a big deal, it's worth having checked out. Absolutely, yeah. I mean, sometimes, just not knowing is enough to get in and get seen, and especially when you're having these subtle symptoms that we mentioned. Because you stress about it and it makes it worse. It's a vicious cycle. Yeah, it is. All right, Dr. Coffin, thank you.